What's good? Welcome to Global Watch Age. Here on this channel, we keep up with the latest world events. We focus on topics such as the environment, climate, health, cultural exchange, and technology. Let's dive into the latest on international headlines. In this video, we'll be focusing on health. Outbreaks are a huge concern globally. Measles is raging in the Americas. 10 countries reporting over 10,000 cases and 18 deaths so far this year. Monkeypox is still a sneaky threat. Experts say it's not gone despite fewer headlines. Chikungunya virus is exploding as a global challenge. Spread by mosquitoes and causing brutal joint pain. Cases going up worldwide. In Gaza, the health system is in total collapse. Hospitals overwhelmed, medication running out per WHO warning. Funding's tanking too globally. Health budgets are down big time from last year, hitting Africa hardest. Abuse during childbirth is still a widespread issue, globally, says WHO. China is dealing with a mosquito-borne outbreak, looks like dengue or similar, with 7,000 cases reported. On the bright side, International Atomic Energy Agency is recycling old radioactive sources for cancer treatments with successful international transfer. Tariffs slowing down the US economy, potentially messing with health supply chains. The USDA's rolling out plans to block New World screwworm from spreading, which could hit animal health and food security. President Donald Trump is dialing back on a lot of what folks call mainstream science in health policy while ditching the WHO involvement. The actions speak loud. Skepticism towards established institutions, big cuts, and a pivot to what's called gold standard science. President Donald Trump wasted no time pulling out of the WHO on the first day in office, 20th of January 2025. He issued an executive order withdrawing the US from the WHO, calling it bloated, conflicted, and too influenced by China and Big Pharma. Robert F. Kennedy Jr., Health and Human Services Secretary, cheer it as escaping medical tyranny and Bill Gates' grip. He's been vocal urging the WHO to treat the pullout as a wake-up call for reforms, but no sign of rejoining anytime soon. This aligns with broader executive actions reshaping US global health policy, ditching WHO agendas on vaccines, lockdowns, and more. Director of National Institute of Health is a big critic of COVID lockdowns and mandates. He is all about ditching settled science as a lie and reopening debates on stuff like vaccines. RFK's pushing to demolish WHO and Big Pharma influences. Thousands fired from CDC, NIH, and FDA, nearly 20,000 across health and science spots. Insiders reports it's chaos. We can't do the science. We are consumed with executive orders. President Donald Trump also shut down EPA science offices, linking environment to health risks like pollution and cancer. Executive order in May 2025 to restore gold standard science in federal research, aiming to rebuild trust, but critics call it code for fringe ideas. Broader push to discredit climate science ties into health via air quality and disasters. Project 2025, which President Donald Trump's team draws from, wants NIH less independent, rolls back regulations on fossil fuels, environment, and hits women's health and reproductive rights hard. Make America Healthy Again Commission, launched February 2025 via an executive order focusing on critical health challenges like chronic diseases, but critics say it's a vehicle for RFK's anti-vax, anti-corporate agendas, gutting programs chasing junk science. Overall, the vibe is a major shift, less reliance on WHO, global consensus, more on domestic health freedom, and challenging established science. Environmental groups like the Sierra Club and Center for Biological Diversity are gearing up to sue, arguing the EPA's relying on fringe science. Critics highlight ditching greenhouse gas rules could worsen air pollution, which is linked to 1 in 5 global deaths and climate disasters, totaling 95 billion in US damages in 2023 alone. A 2021 study tied 37% of heart-related deaths to human-driven warming, and the National Climate Assessment warns of $2 trillion in losses by 2100 if emissions aren't cut. That is the end for our video on health. Thank you very much for your time and attention. We appreciate it. Please engage by liking, sharing, and commenting down below. We really appreciate it. Thank you.